Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, a surgeon is arrested in the death of a patient when he took out the wrong organ. This one's pretty crazy. And then, the largest breast implants in America. We got a video, and we're going to react to it. And then finally, the Food and Drug Administration accuses a local med spa of using illegal Botox. And they're all coming up right now. I'm your host, plastic surgeon Dr. Bruce Hermann. With me is Kalee.
Hello.
How are you?
I'm good. How are you?
Doing good. Always a good Friday when we're here at the studio.
Yeah, I've got some really crazy stories today.
Oh yeah, these are going to be good. Brena, you ready for this craziness?
I am.
Okay.
This is going to be a fun one.
Yeah, these are some good ones. I think you maybe sent me, did you send me one of these, Brena?
No.
Chip did.
Oh, Chip did. That's
Yep.
right. Yeah, that's right.
Because I was in that, and then I looked into it, and I was like, I probably shouldn't have,
Yeah.
so I could have more of a genuine reaction, but it's still.
I didn't go into a lot of detail when I was looking at it. I just kind of clipped it, and I was almost trying to not listen to it. So
Yeah.
that one's going to be pretty good. All right, well, let's jump into it. So, all right. Well, man, this first story is even crazier than the one that you were talking about. This is out of Florida, all right?
Shocker.
This is a surgeon who got arrested for the death of a patient when he removed the liver instead of a spleen, which I know that may sound a little bit odd, but it's even more odd than you think. So we're going to break that down. We actually talked about this story a couple years ago, but I don't think either one of you were.
It's the same story?
It is, but it's got some updates.
Okay.
Yeah, when this happened, it came out, and there was a little bit of information about it, so we talked about it. We didn't really know anything. So we know a little bit more now, and then there's been some updates. So,
Well, can I ask a question real quick before you get started?
yeah, sure.
Are the spleen and the liver near each other?
Yeah, here, in fact, I will jump right in and show you the photo, because that'll help you guys. All
Yes,
right.
I need this.
Now, this is a cartoon, obviously, but you see the liver there. It's the two larger structures. There's a right lobe and there's a left lobe, and then the spleen's the little pinkish thing down there, and they actually kind of touch each other.
Okay.
So they are pretty close to each other, although the liver is considered being more on the right side of the body. It's just so big it kind of goes over to the left, and the spleen's considered to be way far on the left. But note that yes, they are in the same vicinity, but
One is obnoxiously larger than the other.
yeah, usually about 10 times larger.
Wow.
10 times, yeah. All right, so
Thank you.
let's give some background. So August 2024, a 70-year-old gentleman named Bill Bryan, who actually lives in Alabama, was visiting in Florida, started having some abdominal pain, goes to one of the local hospitals there, and of course, he gets worked up, got a CT scan, and it showed that his spleen was a little bit enlarged, okay? So there was a Dr. Thomas Shaknovsky. Now this guy is a general surgeon, which would be the right type of doctor to see him. And Dr. Shaknovsky told him that he really needed to have his spleen out, that he was worried that it might, start hemorrhaging, and that could be a life-threatening problem. And apparently Mr. Bryan was not wanting to do that, so he was trying to put it off. Apparently 3 days went by, and finally on the third day, the surgeon convinced this guy, look, you just really need to have surgery. So, and this all, what I'm about to tell you, actually comes from the operative report, which is really weird because that's part of the medical record that should be protected. And I think the family put it out there because it was just out there on the internet.
Okay.
Which that's helpful because the op report is basically the surgeon saying what went down.
Yeah.
And you hope it's right and accurate, which we'll talk about. So the op report says that he took him into surgery. He started with laparoscopy. So for those who don't know, that's where you make the tiny little incision, you put a camera in. That's really, really common these days.
Oh, yeah.
That and the robot surgery, they're very, very similar. Laparoscopy came around first. So he puts the camera in, and this is all according to the op report, sees that the spleen's really enlarged and decides to open the patient up because he didn't feel like he could do this with a scope, which that does happen. You put a scope in to take a look if it's worse than you think, or maybe it's not is going to be as safe, then you'll convert to an open surgery. So according to the op report, that's what he did. And he says that the spleen was really massive, it was really, really big, but he took it out. And when he took it out, basically you kind of isolate the spleen, and then it'll be on its blood vessels, and you clamp the blood vessels and you cut it and you pull it out. I used to do a lot of splenectomies when I was a general surgeon, because I did a lot of trauma, and people get in car wrecks or whatever, and splenic injuries are really, really common. Because the spleen's kind of spongy. The liver's a little bit tougher than the spleen. The spleen's pretty soft, So like if you get in a car wreck, it's pretty easy for your spleen to get cut, and and you can bleed. And so we did tons of spleens. So anyway, so according to the op report, he got the spleen out, but when he did, he said that the patient started bleeding very, very intensively. And so basically in the span of a minute or two, the patient went into cardiac arrest. They tried to resuscitate him, but they were unable to do it, and unfortunately the patient passed away. So the kicker is that when the spleen got sent to the pathology, they identified it as the liver. And now the weird part is I actually saw the report of that, which is weird that there's so much information out about this case. But it wasn't like a part of the liver. It was like the whole liver, like the whole thing.
So was he confused, like when he said that the spleen was enlarged, that maybe it was just the liver?
I have a lot of huge issues with this story, and that's a really good question. I'm just going to tell you as a surgeon, it is impossible for a surgeon who's had any amount of training to confuse the liver and the spleen. It's just impossible. Like you saw there, throw that picture back up there, Brena. I want to show this one more time. These things are attached to different ligaments inside the abdominal cavity. It's not like these things are just like floating around in there.
And do they look like those colors, like that corn cob thing? Does that look like that in there?
So that's the pancreas. Yeah, it does. It looks pretty similar. I will tell you that when you're using a laparoscope, it is a little bit easier to get lost.
I've been in surgeries that...
Oh, you've seen the laparoscopes?
Yes.
Yeah, right.
And I've seen robotic surgeries as well.
Okay, so
yeah.
you probably have looked at that and be like, what am I looking at? Or where am I looking exactly? And so I have heard of people getting, good surgeons getting lost or confused, okay? But according to the op report, this guy opened the patient up. I mean, once you open the patient up, the liver's up here, and the spleen's over here. Like, there's just no confusing them. Like, to me, the operative report is just unbelievable because it says that he identified the spleen and he removed it, when in reality he removed the liver, which does weigh 10 times as much as the spleen. It's like you're saying I picked up a ping pong ball when you really picked up a bowling ball. You know what I'm saying? Like, they're that different.
Is there a chance that they got it wrong and it is the spleen, it's just so big?
No way.
Okay.
Because, that's
trying.
great. That's a great question. Once you cut them open, they are very different. And if I just had a chunk of spleen and a chunk of liver and showed them to the average person, they very easily could get them confused, but a pathologist would not. Like, the tissue on a cellular level looks a lot different. But here's the kicker. Obviously, this patient has an autopsy. When they do the autopsy says that the patient's spleen was there, but the entire liver was gone. So it was confirmed that this guy took out the entire liver.
Okay.
So I still am really, really, really confused about what went down, but my belief is that the operative report is just completely fabricated. I don't think he really believed he took out the spleen. There's just no way. There's no way that he really thinks he took out the spleen. I just cannot believe that.
So what do you think he was doing then?
So I have a theory.
Okay. Did I tee that up for you?
Well, yeah, because it doesn't make any sense whatsoever. And we are going to find out because, as I said in the intro, he actually got charged, and arrested for this just recently.
Yikes.
My theory is that when he was using the laparoscope, he got the left lobe of the liver. Throw that one more time, Brena. I promised the last time. Throw that picture up. Yeah. You see how the left lobe of the liver and the spleen are kind of close to each other, and they do look a little bit similar. My guess is that he got the left lobe of the liver confused with the spleen when he had the scope in, because it is easier to get lost with the scope. And when he started dissecting out, and man, I wish I had brought the other picture, because what's not showing in this picture is the enormous blood vessels that run kind of right there in between the right and left lobe of the liver. I mean, you're talking blood vessels that are they're enormous.
Okay.
And I think what may have happened is he got lost and he accidentally cut into those vessels, and the patient started bleeding, and then he opened, and then I think he just panicked. I don't know if he was trying to take out the left lobe of the liver because it was bleeding so bad.
So then he just took the whole liver.
And I don't know. But the only thing with that story is that he wouldn't have sent it off to pathology saying it was a spleen because they were going to know. And so I have another theory that maybe he didn't want it to go to pathology, because you don't have to send things off, but maybe because the patient died, it kicked in an automatic, hey, this needs to be looked at. I mean, I don't know. Like, the whole story makes no sense.
Has he gone to court? Like,
no, he just got arrested
Okay.
this past week.
Okay.
So when we talked about it like 2 years ago, I said, number one, this guy's license is gone. Like, there's no way he keeps his license. And literally like a month later, he lost his medical license. And then we even talked about, like, there may be a criminal charge. So he actually just got charged with second-degree manslaughter.
Wow.
Which basically says, let's see, manslaughter, killing a human by culpable negligence. I mean, I don't know. I guess everyone may know what that means. I wanted to look specifically what does it say about manslaughter? So it's anytime someone dies because you did something that you have the blame for. Which, I mean, it's kind of weird. Like, you don't oftentimes see like a malpractice case go as far as criminal, right? I mean, malpractice is usually like civil. And you know, you guys remember?
Has he ever done something like this before?
Oh, what a great question! Yeah, you're so good, man. Just like you set me up.
I'm very interested.
Yeah, so he actually has had two board
actions
before. Once he took out part of the pancreas when he was supposed to be taking out an adrenal gland, which, granted, those things do sit kind of close to each other. And they do look a little bit similar, but you know what? You're the surgeon. You're supposed to know the difference from one organ to another. And then he had another patient die where, like, allegedly some of the intestine got taken out that wasn't supposed to. And
so this is a pattern.
There's a little bit of a pattern here. Yeah.
I'm getting like Dr. Death vibes, but like not as far, you know, like.
Yeah. Yeah, I don't know.
You're like, did how?
I know, it befuddles me because, you know, I have the advantage of actually have done these surgeries. I mean, I've taken out a ton of spleens. I've done liver resections, liver transplants. I mean, I don't do that stuff anymore. But, you know, it's really not possible to confuse those two organs. Like, it's just not. And I just don't know what went down. But I do kind of feel that we're going to find out because when this goes to court, that'll be public record. And then we'll be able to look up and see what really went down with this case.
Yeah, very interesting.
But yeah, it's just...
I'm very invested now.
Yeah, it's just wild. Like, I just don't even know what to think. Like, I have all these like crazy theories of maybe what happened or what he did, but I mean, they don't, like, when I say them, I'm like, there's no way that really happened. Like, that couldn't have happened.
You're like, no.
But then the story is told is completely unbelievable.
Yeah.
So it's just like, wow. It's like, it's the same as like that, remember the influencer girl that passed away and everyone's arguing about what happened with her? And it's like,
I don't have an autopsy?
I don't really believe, yeah, right. And she didn't get an autopsy, which is just absolutely wild. So, all right, what do you think, Brena? Crazy?
Yeah.
You've been kind of quiet there.
Did you, I know. Did you say, did the patient die?
Oh, yeah. Oh, yeah.
Okay.
Yeah.
That's just so crazy to me.
Yeah, liver injuries are one of the more dangerous things that can happen to you because the liver, you know, it basically filters your blood, right?
Yeah.
And so, you know, when it gets injured, it just bleeds and bleeds, and the blood vessels that go to it are massive. And if you get in and around there, you know, you can get in trouble quick. And I remember, like, I've been so far out of general surgery residency that, like, you know, I almost can't remember any particular one case, but I do remember one case where we were doing something and we got into one of the veins of the liver, and it was just like the blood just went like that.
Oh, yeah, that's scary.
And we were able to like get control of it and fix it, and everything was fine. But I mean, you know, it just you get into the liver or get into the blood vessels around the liver, and like you can get into trouble very, very quickly. And I think that's what happened with that guy.
I wonder if he like knew like during the process and was like, oh, I'm too far in and just gonna commit and see what happens.
That's what I think. I think you're right, Brenda. I think that like he made a mistake and then he just ran with it instead of, you know, trying to correct it. You know? Yeah. I mean, who knows? And maybe like his past actions like influenced that. He's like, oh, I've gotten in trouble before, and now I've done this, and I got to try to hide it.
Does he need to go to more schooling? That would be my question. Because
I mean,
if
definitely.
this has happened before...
Well, I mean, they yanked his license, so he's done. He's done.
Anatomy 2.0.
I mean, because I will say, like, I should not be, you know, giving surgery to anyone because I wouldn't know what is what.
It takes a while to get your bearings, for sure. I mean, I remember,
and I've been in multiple surgeries.
I remember the first, you know, surgeries I scrubbed into as a med student, and I was like, oh man, like this is like complicated.
Yeah, I'm like, what is that?
What am I looking at right there? So, all right. Have you heard about the crazy story of the surgeon in Florida who went to take out a spleen in a patient and accidentally took out his liver? It's unbelievable. The patient unfortunately passed away because taking out the liver is not a survivable event. But what's even crazier is that he sent this liver off to the pathologist saying it was a spleen. And of course, they said it was a liver. Patient had an autopsy, came back, spleen was still there, but the liver was gone. It's just unbelievable because I used to be a general surgeon that did these type of cases. I've done plenty of liver and spleen surgeries in the past, and it is impossible for a surgeon to misidentify the liver and the spleen, at least when the patient's been opened up. Now, if you're using a camera like a laparoscope, yeah, it can get a little confusing, but when the patient is open like this one was, it's impossible. Like, I don't believe the story. I don't know what happened. I have this theory that maybe he made a mistake and then he tried to cover it up, but no one knows. But the crazy part is he, of course, lost his license, but now has been arrested and charged with second-degree manslaughter, which is really unusual. You don't see a lot of malpractice cases go to the level of criminal charges, but this one did. And given his history of having some similar things like this happen in the past before, I think it's probably the right call. So pretty crazy story. We'll keep you updated on what happens with that. All right. Now's the big one, and I mean the big one. All right, so this is, thanks to your team, Kalee, Chip, for giving us the heads up on this one, because I hadn't seen this one. So we are going to do a segment on the largest breast implants in America, allegedly. We have a video, and me and Kalee and Brena are going to react to this. I tried not to listen to it. I did have to clip it. So, wow, look at that. Before we even get into the video,
I couldn't stop watching.
Look what's going on there. It's so crazy. Okay, all right, you ready to roll that?
I just watched because I really wanted to know if this was AI or real.
Should we leave our mics on so we can comment midstream? All right, so
let's do it.
All right, let's leave all our mics on. All right, let's go. Ready? Roll it.
I do have the largest breast implants in America. There you go. Oh, and I have the second largest in the world.
I mean,
for the past 8 years, Foxy has been obsessed with extremely large breast implants. She has made it part of her emotional coping mechanism. Foxy says that 8 years ago, she went through a divorce, lost her job, and her grandfather passed away. She felt that her life had completely hit rock bottom. Whenever she felt sad, anxious, or wanted to regain herself, she would rely on continually enlarging her breasts to feel better. Foxy says she started with a C-cup. She has had 4 breast augmentation surgeries in total.
That looks
She has
painful,
also had
yeah.
body facelifts, rhinoplasty, and more than 10 other cosmetic procedures. She now has the largest breasts in the United States. Each implant is 940 cc,
okay, so that's
making
not
her
correct.
breasts the second largest in the world.
I think they mean 9,000
When I look in the mirror,
cc's.
I feel super sexy because I love the exaggerated curves.
No.
I love what
She's
I
got
love.
like serious body
I don't
dysmorphic
want to
disorder.
stop yet. I am obsessed with surgery, but at the end of the day, I'm still the same person under all of the saline.
Oh, saline.
She even hides saline at home and injects it herself. Watching her breasts grow bit by bit gives her
no
an
way.
addictive thrill.
Oh my
She
God.
wants to
Herself?
reach 10,000 cc to break the world record. Even if she bumps
The
into things when
world
going out, can't breathe properly while exercising,
Oh,
or
that's
can't
real.
buckle a
That's
seatbelt,
100%
she doesn't
real.
care at all.
It looks like she
wasn't
can't even,
until
like,
her
get up if
family
she
and
falls
coach
over.
noticed her behavior that they forced her to learn about the risks. Doctors warned that a wrong injection or too much filler could rupture the breasts and directly cause death.
That wouldn't
But
happen.
even knowing her life
She
could
would
be in
die if they
danger,
ruptured.
Foxy doesn't see it as harm. She still wants bigger breasts. She still wants to claim the world's #1 title.
Well, at least she has goals.
Wow. I have a lot to say on that.
Okay, lead us off, Brenda. What do you got to say?
God.
Tell me.
Are they high maintenance? Like, is she gonna have to I don't know, to keep them that full? And
I mean,
like, there's no way the support.
Okay, so
I feel like it would rip. I don't
feel
know.
like before my
That's a
breast
big risk.
reduction, I had very large breasts, and they hurt, and
Yeah.
they were like an ant compared to that.
Yeah, right? Yeah, those are all.
Like your back would hurt really bad.
Yes.
Number one. My question was, did she put more in her booty to help balance it out so
you
that
almost
she
would
didn't
have
fall
to.
forward?
You need like a counterweight
Yes.
back there. To,
I'm thinking we
keep
need
them
something
just-
back there.
to just not just fall over. I mean,
Like how does she stand upright?
she doesn't. Like, to me, that's probably my,
Because she was taking pictures on the street.
I have a lot of problems with what's going down there, a laundry list, but I'll jump to what you said. I mean, yeah, like that's really, really bad for your back. Like you're gonna have like chronic back problems, you know, from having breasts that large.
Yeah.
I mean, you know, anyone who's had breast reductions will tell you that when the breasts get that large and if they're hanging like that, like it's a real strain.
Yeah.
And like over time, like that does like permanent damage. Like you start to get like, just basically the cushion part of your spine, like both in your neck and your back, will start to get worn out because there's
like
so much strain
cartilage.
up. Yeah, yes. And so, I mean, she's basically, you know, potentially harming herself long term as far as like her posture and back pain and all that with having something that big. I mean, it's just literally insane. And when they said 900 cc's, that's wrong. Those are I think they meant 9,000.
Well, yeah, because our goal is 10,000.
Yeah,
so if we have to go that far, then we...
Yeah, no, because 900 cc's, I mean, that's super big. And I'll talk about like what I'm willing to do with implants. But 900, although is very, very big, is not anywhere close to that big. You know, a 900 cc implant would be about probably like this. You know, and her breasts are like that. And of course, you know, since it's a sphere, like as the radius gets bigger, the volume jumps up by, you know, 4
Like, I don't
times.
know how your skin doesn't rip.
Right, and that's the other issue is, because I actually have kind of an interesting story about enormous implants. It's been probably, I think it was before COVID, so maybe 6 or 7 years ago, I got a call from one of the hospitals, and there was a lady that was trying to do something similar to this woman to get like these enormous implants. And what happened was they were so big, it stretched her skin out so much that her skin started to die. And so her implants were 3,500 each.
Like, what? How big is that? Like, I need
So
visuals.
3,500 is probably something about like this, you know. I
Like
mean,
next to each other, though. So they're
yeah,
like,
so like I'm just like saying, you know, like if you had like a 3,500 cc, and probably more like that. I mean, it's pretty good size. You know, maybe like bowling ball size. You know, it's like almost 2 2-liter Cokes if you compact them into a ball. Does that help?
It does, but
Okay.
I just can't. Like, I am one when we do this podcast and we sit next to each other and we look at things. I'm very much like, I don't want to make anyone feel like, okay, what they're doing is like bad. But this is
Sometimes
really bad.
people need tough love, man.
But this is really bad.
This is really bad, right? Well, you know, and who's doing this to her?
And like the doctor, you said, let me ask you this, because I was thinking in my head, could these burst? And you were saying like if that's not true, like it wouldn't cause imminent death.
It would not cause, because, well, as long as they're using saline implants, saline is IV fluid.
Okay.
And so...
So she's just staying hydrated.
Right, yeah. If they pop, she'd have to run to the bathroom and go pee in like 5 minutes because like suddenly her system would be
I'm sorry.
absorbing 10 liters of IV fluid.
So this is the way. Just don't do like the IV membership. You could just...
Yeah, no, she would die if they ruptured, but that saline would get absorbed, you know, pretty quickly. You know, because again, saline's IV fluid. It's basically the liquid part of your blood. You know.
She probably has more saline than water in her body.
Right. Yeah, probably so. I mean, although I don't know. I think
do they float?
No, I think because they're saline, they would be slightly denser than.
Yeah, she
fresh
had to like
water.
lift them a lot. So.
Yeah, and
I
so,
can't believe she even goes to the gym.
Yeah,
I
was
know.
shocked to
Like,
see
she
that
was
part.
like on her back. She looked like a turtle that had gotten put on its shell. She couldn't get up.
We also
Like,
have a comment.
Oh yeah, what's it?
Cindy, she said, "How is she injecting more saline at home without causing leaks or ruptures of the implant?"
So if that's true, then there are
good
certain
question.
implants
Yeah.
that have like a port. Now these are not things that they have in the United States, which brings up the question of did she have these in the United States? I doubt she did. I just.
It did sound like it was not from the United
Yeah,
States. Like the story.
It would be hard for me because in the United States, you know, if somebody wants to get implants that big, you have to buy the saline implants from out of the country because the saline implants in the United States are capped, I think somewhere around 1,000. I mean, hardly anyone uses saline implants anymore. So, you know, so she probably got them outside the United States. When that one lady that I took care of, where I had to remove the 3,500, which by the way is a total catastrophe. When you remove an implant that big, the breast is unrecognizable. It's
Like,
just,
what do you do then? Like, what did you?
I mean, what
did you do anything or?
I told her like I didn't want to jump on the grenade, and I was like, look, I'll take out your implant because your skin's rotting off, and I'm gonna like put a drain in and close you up. But you need to go back to your surgeon that did this to you. And she was telling me that there's like only 2 surgeons in the United States that will do these like crazy, insane, large augmentations. Like she had 3,500 and she was trying to go bigger. And she was telling me she was gonna have to go out of the country because the 2, one was in Los Angeles and one was somewhere weird like Utah or Denver or something. Like they were kind of capped out at what they would do. So I don't think that someone in the United States gave her 9,000. I don't think so.
So what's the largest you would do?
So
you said earlier.
Yeah. So the absolute largest I would do would be 800 cc's. That's it.
And what would that be?
So 800 is probably about like this. I mean, it's really big because you think.
You remember that video that we shot where we threw them at you and you were blindfolded and you had to tell us?
Yeah, so we were doing, so those are like 400, 500.
Okay.
Like
there were some big ones.
My preference for cosmetic, now for reconstruction it's a bit different. You can use, I'll use like up to like 11 or 1200, but remember those patients have no breast tissue, right? So with no breast tissue, that much volume gets swallowed up pretty quickly, and you'll need that to match them up to what
if they do have tissue? I'm sorry, I have random questions.
So that's the difference between a reconstruction where they have a mastectomy and all the tissue's gone, or cosmetic where they do have tissue, right? So if they do have breast tissue, like we're just doing a regular breast augmentation, I mean, I've done 800 a time or two, but I try to talk patients out of not going that big, and it's usually when they're swapping from like a 700 to an 800. They already have something big, and they're like, look, I just want to be a little bit bigger, and I'm like, okay, well 800 is the max. Like I don't know, I give my spiel about as they get bigger, you're more likely to want to take them out sooner. You can have issues, and I don't commonly do implants over 500.
I wonder if she's
maybe
single.
Once a year, huh?
Like if she's single or if she's married, because like I don't think anyone else can sleep in a bed with you.
Yeah, I don't even know how she sleeps. I mean, because those things are heavy. I mean, if they're 9,000 cc's, let's see.
Oh, that's a good question. How much does that weigh?
It's about 10 pounds per gallon, which is what, 3.4 liters. So it's probably 30 pounds per side. So there's like 60 pounds of weight on her chest. Yeah, it's like a ton, right?
That is wild. I don't know how you live like that.
Yeah, it's crazy.
I would just be complaining every day, all day.
Yeah, and she's still trying to go bigger.
I don't like to be uncomfortable.
I feel bad for her because
I do too.
She's obviously got some mental issues with this. I mean, I don't think any kind of well person would look at that and be like, I want to go bigger, I want to go bigger. Like there's something going on. And then I feel bad that someone's taking advantage of her and saying that they'll do surgery on her.
But my question here is it legal to allow someone at home to have saline to inject themselves with? Because they said that in the story, she has saline at home to inject.
It's probably not illegal, although you would probably run into malpractice type issues if you did that. Like I would never let a patient inject themselves. I've used expanders that had ports before, but more for like reconstruction, but I would never let the patient access them.
Yeah, that's like my question. Like that was part of their story. Like they didn't even like beat around the bush. Yeah. They were like,
I don't know.
Saline at home and she injects herself.
There are implants out there that you can do that, and if she was shown how to do it, it is believable that she might be doing it. But I mean, that's not good. That's why again, I can't imagine she had this done in the United States. I mean, it just, I don't know. I would argue that what's happened to her is malpractice, and that you could go after the surgeon that did it, or potentially sanction it, like board sanction them.
I can't believe that plastic surgeon allowed himself in that video.
I don't think he's the one that did it.
Well, but like, keep me away from that.
I know, right? Like guilt by association. Yeah. All right. So today we watched the craziest video of the woman with the largest breast implants in the United States. They are allegedly 9,000 cc's, and man, they are just humongous, and she wants to go bigger. I can't believe it. I'm totally against this. The absolute limit I'll do for breast augmentation is 800 cc's, and I really prefer patients don't go much above 500 because there are big downsides to get such large implants. For something like this, I mean, her breasts are going to be so thinned out that she could actually have death of her skin, of her breasts, because there's so much pressure. Not to mention the weight. We figured out that these breasts weigh 60 pounds, 30 pounds a piece. How does she walk around? Her back might snap at any time. It's just unbelievable. I'm very upset upset that someone is taking advantage of this poor lady and keep doing surgery on her. I mean, she obviously has some dysmorphic, body dysmorphic disorder going on. I personally think it's malpractice and that someone should lose their license for what they did to this poor lady. It's just sad, honestly. So yeah, check out the video. It's absolutely crazy. So, wow. All right, we got more. We have 3 shocking stories. We need a feel-good story.
I know.
It just happened to be what was going on, right?
Hey, it's in the news.
All right, so this is a news story from our own backyard. Normally when we're talking about bad things, it's like Florida. Yeah, this one's from our own backyard. So this is about the Food and Drug Administration accusing a Southlake, Texas spa of using illegal Botox. So this month, Food and Drug Administration sent a letter to the Pure Indulgence Med Spa. That's here in Southlake. Never heard of it, but there's a med spa in every corner in this Metroplex. I wonder how many med spas do you think are in the Metroplex?
Oh, I mean.
How many do you think, Brena?
I have no idea.
350. I might be underselling it.
Honestly, I bet that's
in the United States.
No, in Dallas.
In
Dallas
Dallas.
Metroplex.
Sorry.
I bet that you're probably pretty close. That 350 sounds pretty good. I'm not sure
I feel very strongly
Do you
about
have
it.
the answer?
No, I don't. I can look it up. I don't know. I mean,
Brenna, can you look it up?
Yeah.
yeah. See if you can look it up while we're talking.
Like, are we talking Dallas and Fort Worth?
Yeah,
or?
Dallas Metroplex, the
Okay.
Metro.
Yep. Mm-hmm. Okay.
I'll say like
I think about
200.
350.
I'm gonna go with over. I'm gonna say 400.
Oh.
Okay, I like it.
But I like your number though. All right.
I went too low, but I'll.
Well, you
Like,
might be
oh, no.
you might be right. I don't know. I'm just guessing. Okay. So anyway, how
I
do we
think
go?
you
Oh
might be
yeah.
right.
So Pure Indulgence Med Spa Southlake. I haven't heard of them. Don't know anything about them, although I did learn some from reading this. So the biggest claim in the Food and Drug Administration, who sent them a letter, was that the spa dispensed significantly more units of Botox than they'd actually purchased. Okay, so they had to like show a record of how many Botox they had given, and the number that they said that they had given was like, it didn't say specifically, but it sounded like it was multiple times over what they had bought, which begs the question that the FDA has: where did you get this Botox that you say that you injected? And so the FDA.
Wait, can you explain that to me again?
Okay, so there's a record
Sorry.
of how much Botox was purchased from the Botox manufacturer. I think it's Ablify. I can never remember their name. Like they have like a weird name. The people that manufacture Botox.
Okay, got
right?
it.
So there's a list of like, okay, we purchased say 10,000 units of Botox. Okay.
Okay.
But in that same time frame, we injected 30,000 units of Botox.
Got it.
And I'm
Okay.
making up these numbers.
Yeah,
I'm
no,
just
but
making them up.
it's helping me understand.
Right? Yeah.
Yeah.
Okay, good. So that would beg the question of,
So then where's these units coming from?
where do these Botox units come?
Okay.
And the FDA just flat out is accusing them of obtaining the Botox from unauthorized or illegal sources, which would likely be, if true, now this is alleged, no one knows for sure, although there's some more evidence, that it could have been purchased out of the country. In fact, we did a segment. I'm not sure if you were here when we did this one, Kalee. You may remember, Brena. Were you guys here when we did the segment about the people on TikTok buying their own Botox from out of the country and injecting themselves?
Yes, I think I was actually here for that.
Okay,
Yeah,
all right.
Yeah.
So it could be a scenario. It potentially could be a scenario like that where they're purchasing it from out of the country, and I don't know if you guys remember, the price of that stuff that's not FDA approved from out of the country is like dirt cheap. Because the next question that I think a lot of people would have be like, why would they do this?
Yeah,
You know?
especially if they are purchasing legitimate.
Here's the thing: is that when you buy Botox in the United States, it's kind of expensive. I think our cost per unit, like for the cost of it and like the materials and stuff, is like $8 a unit, and we only charge like 11 or something. I think per unit.
Yeah.
So we're making $3 a unit, which means you go and inject some Botox, you make $150.
Yeah.
But if you're paying $2 a unit and you're getting 11,
Yeah.
then suddenly you're getting like $500 a patient.
Ooh, yeah.
Right? So like there's that potential, gain if you buy Botox that's not manufactured here in the United States. Now,
I have an answer for y'all.
oh, do you? Were we close?
So I don't know how accurate this is. I did both Google and ChatGPT. ChatGPT says Dallas alone 769, Fort Worth
I was gonna say.
104, but it says
I
Texas
believe it.
is one of the top 2 to 3 densest markets in Texas. But then Google just says well over 100 with over 145 results. So I don't know how accurate
I will tell you, I agree. Like, because I thought 350 was a little
Crazy.
low.
1,000.
Yeah.
Well,
Yeah.
I thought it might be a little higher, but I was like, man, that's a pretty good guess. Okay, I'm gonna see if I can figure this out.
Yeah.
I'm gonna try and figure out how many.
Sorry to interrupt.
No, that's good, Brent. Okay, so there are, and so I'll say that there's a lot of like really sketchy med spas out there. I'm the first person to say that my industry, whether it be say plastic surgery or med spa, because I do have a med spa, the industry is sketchy. I mean, I think because it's cash paid, like it attracts people that are willing to, maybe cut corners.
Yeah.
And I'm not saying that this med spa did that, but it is believable,
Yeah.
it's believable that something like this could happen. But here's some other things. The manager of the med spa, I can't remember her name, but the manager of that med spa had actually pled guilty to a very similar accusation when she owned a med spa in California.
So here we are with our patterns again.
Yeah, which doesn't mean that it happened this time, but she did actually plead guilty to an almost identical charge. Also, there was a strike against the medical director in 2023 from the Texas Medical Board. So what do you guys think that what kind of background do you think the medical director had? I mean, you would want somebody that knew something about aesthetics, right?
Yeah. I mean, that's assumed.
Yeah, definitely.
Well, yeah, unfortunately, that's an assumption that oftentimes is wrong. So this doctor, Dr. Newman, is an anesthesiologist, which really,
It's not the same.
I mean, anesthesia residency teaches you absolutely zero about aesthetics. I mean, absolutely nothing.
Okay.
Now, granted, you could maybe go take some weekend courses, but to me, I've always said that the best med spa directors are either plastic surgeons or dermatologists, because those people actually do get aesthetics, especially plastic surgeons get aesthetics in their training. And so, like, we literally have to, in order to get our to graduate from our programs, like we have to get experience doing those, non-surgical things like Botox, fillers. Like you can't graduate unless you've done them, which means that you're taking classes on them, you're learning them, and then all of us do them, right? I mean, almost no anesthesiologists are out there doing Botox. It makes no sense. Why would you go to an anesthesiologist? So he had gotten some ding by the Texas Medical Board for failing to exercise due diligence in the treatment of a patient, which I looked up the board thing, and it made it sound like he was just not really involved with it. Now, I don't know. It's with reading the Texas Medical Board stuff. It's like reading government stuff, and it's hard to kind of put the grasp around it. But yeah, he did get a strike about that. But yeah, this is all alleged, but it is alleged by the Food and Drug Administration, and the place is cooperating. They're trying to sort out whatever discrepancy there was, and who knows? It may come back, and it was maybe a clerical error or something. But it is a pretty big accusation.
Yeah.
If it's true, it's bad because if they're passing off like Botox that's from somewhere else, then there is some safety issue with it, right? I mean, I don't know, when we talked about the TikTok people buying Botox, one of the biggest things, like, you don't know like what regulation that product had when it was made. You don't know if it's like maybe like a super hot vial where like instead of being 100 units, it's 1,000 units, and it potentially could be harmful, or maybe it has bacteria in it. And so, I think that, if it ended up being true, I would have, a big problem with that, because patients are coming in, you're telling them they're
trusting you.
Yeah, they're trusting you. But again, it's all alleged, who knows? I mean, hopefully like there'll be some sort of follow-up on this. Yeah. But yeah, it's interesting, our own backyard, You typically get the people around here play by the rules, but
Guess we'll find out.
So, all right. We were talking about a pretty wild story where the Food and Drug Administration has accused a local med spa, local to the Dallas Metroplex here where we're at, of using illegal Botox. So what is illegal Botox? Well, that means Botox or Botox products that were not purchased through the normal pathways here in the United States. You can buy Botox on the internet from other countries, but there is not any Food and Drug Administration regulation on these products, which means that you don't know the quality of it, you don't know if there's any issues with contaminants, and so it becomes a safety patient issue. Now, This is all alleged. The Food and Drug Administration has accused them because of the counts of how much Botox they've used versus how much they've bought, but don't know anything just yet. But if it's true, it would be a pretty bad thing because those patients go into a med spa trusting that they are going to get safe treatments and they are going to actually get what they paid for. And so that does, answer why would someone do this? Well, that Botox you can buy out of the country is super cheap. You could make a ton more money passing that off as real Botox. So we'll see what happens with this one. It's pretty wild stuff. So, all right, another one in the books. That was a good one.
It was. That had a lot of really good stories.
Yeah, some good stuff.
That
All
was
right.
crazy.
All right, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like, subscribe button, and leave us a comment because we will do a segment on what you want to hear about on the next episode of Nip Talk. Bye.